If I
Into
in the next few minutes, we'll just give Jeremy a few more minutes. So now it would be better. Okay.
Yep.
So where is now the Dr. Sophia and who's going to come in? Rida, how is Sophia and others going to come in?
Dr. Sophia is here.
Or so Sophia is there. Sophia, hi, can you hear me?
Yes, sir. I can hear you.
Okay, you can hear me. Good. So let me just get Vajia as well. Vajia, Ryan. Did we send Rida the link to Ryan? Oh, we got all of them on Zoom. So let's start.
But it's hard to control on the live. I'm not sure how to bring up every those like here.
You don't need to bring them up. And if you're not ready, then do it next time.
It will automatically on probably, but I need to make sure that when those on live is the talking, it's the one that is talking.
So where is the talking person?
It's now.
She's gonna come in Zoom as well.
Yes, she need to come in Zoom as well.
So one is Jannat. I'm gonna make her pin her. So Jannat is on the top. But is she gonna share her screen?
So we need to check if she shared the screen. It should be automatically pop up in the Zoom on the live for the live
when she's talking.
Yeah.
Okay.
Because there's no other.
So Rida, bring Jannat and bring Vajia at the top, please.
Jannat.
I pinned her somewhere.
Add pin. Okay. Dr. Vajia is not here.
If I had, I should have. I think I should have practiced this with you. You guys should have had a host present it, and then you would be good. You did not practice. Melia, you're going to make sure that you go into every fine detail next time when you're doing this with them. It's not just a yes, 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 no, no, no. So even the social media part, it's just like you have to be intricate in every detail. Vijaya, good afternoon. Are you on?
Sure.
Yeah, just keep that in mind. That's what's an error on their part. You have to be meticulous. Vijaya, are you on Zoom?
Not right now because I informed you about.
You were going to present the first case. So you want to present the second? So just be ready. Come on later on, present the next one. Okay? Can you do that or what?
Actually, बहुत मुश्किल से मैंने इसको सुनाया लेकिन मैं जैसे ही हटूंगी she will wake up. So that's the issue.
Right. So all.
It's quite irritable. सुबह से बहुत बुरा हाल है.
So what you could have done is given the presentation to Akif or someone else. Is he presenting with you? Because now I have all the 30 people or 40 people waiting for you.
Sir, let me try. Let me ask my mom.
Okay. Gotcha. Okay, thank you. I'm not doing that, leaving that thing. You're not, guys. Let me just see. Okay, let me know when we can do this. Okay. Hi, Jana. Hi, Jana. How are you? Good. Are you ready to present?
Yes, sir.
Okay, come online and then you screen share, and then we'll have you and Sophia will present it. Okay? Because I can't see Ryan. Did Ryan come in?
I think they have left because they were not in Genesee.
That's okay. We'll do it next time. Okay, cool stuff. So let's come on and we'll just present it. Okay. Sophia, can you hear me? Let me just call her. So will it go public now? If I.
Yeah, it's public now and audio
Yes,
is
sir.
open.
I can hear you.
No, don't open.
Okay.
All right. Hi, and welcome everyone. We're here with another episode of Khan Clinics, which is powered by, as you know, American Muslim Today. So today's topic is a little bit off track. We're going to be talking about sleep. And I want to make sure that all of you don't fall asleep today, right? Because bear with us. We're first time around going on Zoom and YouTube. So Jeremy and the team are working on this very efficiently. We have a couple of topics here for you. One, we're going to talk about insomnia, and Dr. Vijaya should be going to give a brief presentation on that. She's held up a little bit, but she'll be here for soon. And then the other topic is going to be by Dr. Jannah. Dr. Jannah is going to be talking about restless leg, and she is going to be talking about it with Dr. Sophia. Mr. Akif is going to help Ms. Vajia about the topic. So first of all, hi, Dr. Jannah, can you hear us?
Assalamu alaikum, sir. Yes, I can hear you.
Fantastic. So let's see your screen. Share your screen with us so we can have a look at your slides, and then we'll have a topic discussion. All right. So Dr. Jannah is going to talk about restless leg first. And Jannah, with Dr. Jannah, Sophia is going to be helping and co-hosting this with Jannah. So the aim here is they both talk about restless leg. They will discuss sort of like have a little dialogue. I want them. Sophia is the person who's gonna be having ask all the questions, and I will interject in. And then what we want also is you, the audience, if you have any questions, you could put it in a chat. That's option number one. The chat link is live right now, and I will take up the questions from there. And then at the end, if anyone has any questions, Rida will let us know, and we will be live asking any questions you have. So I'm going to hand over this process to the next team, the next generation, which is Dr. Jannah and Dr. Sophia. Hi, Sophia, how are you?
Hello, Dr. Khan. Good afternoon, everyone. I am fine, Alhamdulillah, and we're very excited to be here to tell everyone about this very important topic, that is restless leg syndrome. And I will let Dr. Jannah start with her presentation.
Very nice.
Okay. Assalamu alaikum, everyone. Good afternoon. So the topic we are going to discuss today is restless leg syndrome. So first, we are going to give a little bit introduction, like what are restless legs. So it is basically a tingling or a crawling sensation that is felt deep within the legs, and it is often described as if the ants are crawling on the legs. And some people also describe it as a feeling of pins and needles. And different people have different kind of feeling. Some people also describe this feeling as a pulling or a tugging sensation in their legs, and particularly it occurs in the calves. And some people who have advanced restless legs, they can also have these feelings in their arms. And this can also be described as a mild to moderate ache or burning sensation in the legs, which is worsened when the person is sitting or lying down. Another very important feature of restless legs is that it occurs when the person is still, and it also occurs in the evening hours. Like the patient would experience this feeling mostly in the night. So, a very important feature of restless legs is an overwhelming urge.
Just one little question. So here's what we want to do, try to do a little bit different. Jannah, you're like presenting not to the audience anymore. You're going to be talking to Sophia. And I want you to sort of like have a dialogue with Sophia. Forget the rest of the audience. So you could say like, hey, Sophia, do you know if anyone has tingling and crawling sensation? What does that mean? Does that mean, and it makes you urge or move your legs? So it's a little bit like a dialogue, not like a little present. You remember we had that little chat where we said, okay, let's get everyone else, we're going to get everyone else involved and practice that. So wonderful. I got all of that. But I don't know if Sophia got all of it. Sophia probably did. She's pretty smart. So if every time anyone feels any ant on the leg, does that mean it's restless leg? All right. So I want you, and let's try again. Let you and Sophia have a dialogue. So Sophia, you got to interject in. And if she doesn't ask you, you're going to question her. That's how we're going to do. All right.
Okay.
So,
yes, sir.
Like I said, a different format, but we want to practice. And then your audience would definitely want to hear what you guys are discussing and what are you chatting about even. Let's start again. Go on. I'll let you continue, Jenna. And just continue your presentation, Jenna. Don't let it go off. Keep your slides up. Okay?
Mm-hmm. Okay.
I think you were going to play the video. That's why, probably. Is that right?
Yes, sir.
Okay, go on.
So the next thing is that let's look at how does the restless leg look. So this is a video, and this is how the patients are usually seen kicking in their sleep when they have restless legs.
Oh, so it's like kicking someone in your sleep. Is that correct, Dr. Jana?
Yes, and mostly the patient would describe to the provider that I kick during the night, or my bed partner, they say that I keep on moving and kicking my legs during the night. So that would be the main complaint the patient would be coming to the
Oh, so the
provider with.
patient is going to notice that he or she is kicking their legs, or it's like mostly involuntary response?
Yeah, this is basically an involuntary response. Like the patient does know that they are kicking their legs, but they cannot help it. They cannot control the feeling because it is very, it is like an irresistible urge to move the legs. And when the patients are moving their legs, it is transiently relieved. Like the patient would feel a little bit better when they're kicking their legs. Or most of the times, the patient would try to stretch their legs. So the feeling is a little bit relieved this way.
He's playing soccer. He's trying to
Yeah.
flex his legs. It's and he's moving his legs and he's asleep. So he cannot know what he's doing, right? If this is what's happening. So a common other thing, Jana, you want to maximize your screen, please, back again. It's on your, show your slide full so we can see it better. A lot of times when the patients come in, you know what they say? Doctor, my husband kicks me during the night. That's what they say every single time in the clinic. They say, "Oh, he's not good during his sleep. He kicks me. I have to go to another bed." And he's playing less soccer. I'm sure he's passing the ball. The other ones try to hit a goal, and they really whack it. And it's really like CR7, Ronaldo kick, like a full leg thrust. So they can, and this one is moving one where others move double legs. So it can be very bad. So very nice. Okay. Go on, Dr. Jannah, please tell us more a little bit about it.
Okay, so the next thing we are going to look a little bit about is that what are the different causes of restless legs. So most of the times, there is not a particular one reason that we can define for a patient, but mostly the experts say that it is because of an imbalance of dopamine transmitter in our brain. So dopamine is a transmitter that is used to control the movement and sensation, and it is the imbalance of this neurotransmitter in the different regions of the brain that can contribute to the development of this problem. So it is also very important link association is with the iron deficiency. So patients that have a chronic deficiency of iron within their blood, they also have this restless leg syndrome problem. So whenever the patients come to the clinic, the doctor would advise a serum ferritin level. So this can reflect the different iron stores in their body. So most of the patients are given supplemental iron, or they are given iron transfusions to bring that level to normal. And
so you mean, Dr. Jana, that the patients who have iron deficiency, because we see a lot of patients in clinic that have iron deficiency, especially in Pakistan as well. So they are at risk of RLS.
Yes, in Pakistan, as we know, that diabetes is very common, and secondary to diabetes, the patients have a chronic kidney disease. So these patients have a problem in metabolism of iron in their body. So they are mostly iron deficient, and these patients have very bad RLS. Like whenever they are even on their dialysis, these patients cannot control the irresistible urge to move their legs. So
So
mostly they are
what is the
shaking their
iron,
legs during
Dr. Jana,
dialysis.
what is iron deficiency? What do you mean by iron deficiency?
Iron, as we know, is a mineral in our body, and it is very important in the production of red blood cells. So, red blood cells, as we know, they are used to transport the oxygen to different parts of the body. So, when these patients have a deficiency of iron, so these are reflected in the ferritin stores in their body. So, this can contribute to RLS.
So do you think that is a low blood level is iron, could have iron deficiency? If my blood
Yeah, it
level is
can
low,
be. Yes, firstly, when the patients have their CBC, which is the complete blood count, so these patients can have a low level of hemoglobin in their blood. And when these patients, when the detailed CBC is done, these patients have iron deficiency anemia. So, so serum ferritin level is very important because some patients they can have a normal level of hemoglobin in their blood, but when their serum ferritin is checked, that is a low level. So ferritin reflects the stores of iron in our body. So serum ferritin is a very important test that is used to test whether the patient has iron deficiency or not.
so
So
generally a
even
lot of
when,
times, generally when the
yeah,
blood level is low, their ferritin level is also low. But sometimes the blood level is normal, their
yeah,
ferritin level can be still low. Okay, right?
yes,
That's what
and for
happens.
anybody, yes, and for anybody that we suspect that they could be having iron deficiency anemia, the first test that we can do on them is a serum ferritin level. If that is low, it means that the patient confirmed diagnosis is that the patient has a deficiency of iron in their blood.
Gotcha. Okay, makes sense.
Okay, so the next condition that is very important is pregnancy. So the patients, mostly in their third trimesters, they can experience these symptoms of restless legs in their body.
Okay.
Or the chronic kidney disease we have already mentioned, and some patients who have peripheral neuropathy and Parkinson's disease, they can also have very bad restless legs. There are also some medications, some antidepressants, some antipsychotics, and even some antihistamines. These medications can also cause RLS. Like we have these, especially the antipsychotic medications, they have very bad RLS.
Gotcha.
So these are basically the important factors that can contribute to the development of this problem. Now, the next thing is that why we need to identify RLS in sleep and how does it affect the quality of life. So, as we know that it is an irresistible urge to move the legs. So, when the patients are continuously moving their legs in the sleep, obviously it can make the patient difficult to relax and fall asleep. So, the patient can have insomnia, which could be sleep initiation insomnia, and even if the patients fall asleep, they are continuously kicking their legs. It can cause nighttime awakenings. So the patients are continuously waking up throughout their night, and this can lead to, reduced sleep time. And the patients are waking up again and again in their sleep, so it can cause fragmented sleep, and the patients may not be able to get enough REM sleep, enough restorative sleep, and it can impact the overall sleep quality.
So, Dr. Chana, what do you mean by fragmented sleep?
So sleep fragmentation basically means that the patient has fallen asleep, but they're continuously waking up. So they're repeatedly kicking their legs, and it is causing them to awaken during their sleep. So this is called sleep fragmentation.
I have a question.
Yes.
Okay, keep going, then I'll ask the question.
A very important thing is the impact on the bed partner. So, since the patient is continuously kicking and tossing and turning, so the sleep of the bed partner can be very disturbed because of this, as Dr. Khan has already mentioned.
Okay. The slides have flipped off again, Jannah.
Okay, sir. Can you see the next one?
We can see it, but it's not the full screen again. When you click the slide next, just press the next button. You just click the next, and even if you do it right.
Okay.
Perfect.
So yeah, do you have any questions, or should we go to the treatment options?
Yeah, we should go to the treatment for now.
So I have a question, Jannah. So
Yes.
in general, you mentioned that restlessness can happen with, is obesity got a factor with it? What if I see someone sitting and they are, you see a lot of times people are sitting in their chairs and they're just moving their legs. And you just look at them and you say, oh my God, that's very irritable. Or is he uncomfortable? Or why is he moving his legs? So does that mean he has restless leg? Could he have restless? How would you define it? How would you know that he does or does not have it?
So the first thing is that if the patient has restless legs, then their symptoms would be increased towards the evening time. So, and the other thing that we have to look into is that this urge to move the legs, that is mostly increased during periods of inactivity. So when the patient is inactive, he is lying on the bed, then he would start feeling this urge to move the legs.
So it seems like the bottom line is, even if he wanted to control it, he can't control it. So if you are sitting there and I tell you, Jannah, stop moving your legs, or you tell your husband, hey, Hussein, don't move your legs now, and he still doesn't know and he starts moving them again, and then you ask him, man, why are you moving your legs like that? And he will say, if I move them, I feel better. It's very uncomfortable if I don't move my legs. That's one of the first signs that you have restless leg. That is, there is an involuntary urge to move, and you don't a lot of times even know that you're moving your legs. Yes, it can be in the evening. Yes, it can be a crawling sensation. Yes, it can be other, like URGE. It can be all of the others, the E, the movement, but the main thing is, a lot of times they don't know they're moving their legs, and they feel better by moving this. It's just, now it's a difference. It could be a habit. Some people have a habit of moving their legs, and some people don't. Like they're not, it's not a habit. You tell them to stop their legs and they're like fine, they can control it, but they will be fine and say, oh yeah, sorry about that. But they will say, oh, it's just a habit. But then are others who will tell you, hey, I'm feeling something on my legs. If I feel it, and if I move my leg, it goes away. Now, could this be that you correlated with diabetes? And you said, oh, diabetic patients can have restless leg as well, right? But note, that's a neuropathy. It's different. The nerves are tingling. It's a bit different than you having this restless leg, all right? There's subtle differences in it. Similarly, patients whose blood flow is not good can have issues with it. And we both have to differentiate the two topics, right? The blood flow being not proper and the nerves being not right. But what is one of the biggest impact of this? The biggest impact of restless leg is when you sleep. That's the problem. Sophia, you get that? During the daytime is all right. Yes, but when you have to move the legs during the night, it disrupts your sleep. That means you do not go into deep sleep, or it may even disrupt your REM sleep. That means you won't get restorative dream sleep. Your dreams are not going to be right for some reason. Whether you don't go into proper non-REM sleep or REM sleep, the sleep is affected by restless leg as well. In that condition, when we see that, it's called periodic limb movement, and that's what you were showing. So we get the gist right now. We get where I hope everyone's getting a little bit of just what we're trying to say here, right? It's not that you have restless leg and it's a crime or it's a wrong thing. You can have it. It's all right. We just need to fix it. But also it's important. It makes you, if you don't sleep, you're not fresh in the morning. And that's where it becomes an issue. Your iron level is low. You're short of breath. You're exhausted. You're tired. And then on top of that, if you don't sleep the double again, you have a double jeopardy. You have a double problem. And that's where the problem is. So if you see someone doing that, you should be cautious. And if they tell you, if you see someone moving the legs, and then if you see someone coming and they look tired as well, then you got a bigger issue. Then you can argue, hey, dude, are you doing this in your sleep? And then you got to get that fixed. And that's the whole gist of this discussion. All right, what can you do? And then there is some treatment aspects. Jannah is going to go over it a little bit, just to explain everyone else that where the thrust of restless leg is. All right, make sense?
Yes, sir.
Okay, cool. Go on, Jannah. Tell us about treatment a little bit. Yeah, I see that some people saying my sister has it, my brother has it. I want to say a little comment. It can be the incidence may be equal in men and women, but in women who are young, it's an issue a little bit, especially if they're having heavy periods, especially if they have any gynae issue. You have to be sure that the blood loss is being replaced adequately. And that's one of the things. And in men, if you see someone with restless leg, you can ask, dude, are you sure you're not bleeding through your bowels? Because we have picked up colon cancer from this. Even when we ask them to check their ferritin, they go and check the ferritin. The doctor's first response is give them medication. It should get better. If the ferritin level is back up, then good, right? But if the ferritin level goes back up and drops again, then you're losing blood from somewhere. You have to fix that. You have to fix where the blood loss is. So we've diagnosed colon cancer sometimes. So we say, oh, your age is, when is the last time you had a colonoscopy? Or when did you have that procedure done? Or have you had your colon checked? Or could this bleeding from, so the next response is do a blood test after the ferritin level is checked and screen for different types of diseases. So you could be minor sickle cell, that's blood loss. You could even have subtle malaria going on where the malaria is destroying your cells and it's been diagnosed. Or you could be losing blood from anything else, subtly in the bone marrow. Cancer can do it indirectly, make your levels go. But the bottom line is, if I give you iron, if I give you ferritin, it should get better. All right. So I just want to interject that point in. And I want you to just sort of like, when we're doing this live to the Sunday, by the way, I've got a Sunday morning webinar, and Jannah is going to be presenting a modified version of this. So do come and attend. This is sort of like for everyone, a little message. It's Sunday. I think it's July the 20th or 21st. Which day is July? July the 20th. Jeremy is saying it's July the 20th. And the time for you guys back here is 6 in the morning. Me and Jeremy are going to be here on Sunday morning. And for you guys, I think it is 4 p.m. All right. And then 4 p.m. there, 3 p.m. in India. And it's 10 p.m. in 10 a.m. Sorry, 12 a.m. in England, or noon time in England. Someone's also asking about what time is it in England going to be. So it's 12 noon. And then Zalika and the others will tell us what is the time going to be in the Philippines. But that's where we're going to be discussing a little bit more about it. Okay, so let's just hold there for a second, Jannah. Jannah, you're going to stay there. And I'm just going to have, I'm going to see if Dr. Vijaya has made it back. If she has, fine. If she hasn't, then we'll just double check that. Is she available?
Yes, sir. She's just joining in.
She's just joining in. Okay. Anyone, any questions on this? We're going to, on the Zoom, please, you can ask questions. And then if you could react or raise your hand or give a cloud or anything. There's a react button there, and then you can just press that. And then we'll be happy to take, and you can raise your hand as well. It's like a little thing. Please, if you have any questions, we want to try to take a few live questions. Let's see who can ask a question. Got quite a few people. No one? I put my hand up and you can. Anyone, you can still got a few minutes. But GI is not in yet. Go on, Rida, you have a question. Go and ask. You're the brave girl.
So I've noticed that children in particular have this sort of, I mean, whether or not they have so much energy, that's the reason that's causing restless leg syndrome for when they're sleeping or something. Or could it be an underlying condition that we haven't particularly noticed? But why do kids in particular have this?
Good girl, and a very good question. Okay, number one, kids also have sleep disorder breathing. If they have big tonsils, if you are not sleeping well, there is a good distinct possibility that you will kick in your sleep. You also, kids do another thing. If they're not breathing well and their breathing stops, which is called sleep apnea, which is one of the topics, by the way, which Brenda and Lexi and Sophia and Fatima are going to discuss. If they are not sleeping well, kids, they will wake up tired. What else will they do? They will wake up, their growth gets retarded. Number three, yes, you should even in them check their iron levels. One of the other little things kids do is that not only you can have restless leg in your legs, but you can have it in your arms. And that's strange. So some of the people just keep on moving their arms and they have restless leg. You don't necessarily have to move your legs to do that. So the manifestation of restless leg is moving your upper extremity and be fidgety. So if they are having that, you need to look into why they're doing it. Like I said, kids may do it. Sometimes, one of the other times kids do that a lot is when they are playing video games and they don't want to go to the loo. They will resist to going to the loo till the last second. Even if it comes out there, they will accept that, but they will not let themselves get killed in the video game. Have you ever done that, Jeremy? No? Play a video game and resist getting up. And even if you have a loo and then you're moving your legs, they move their legs a lot, left, right, center, try to keep the loo inside. And then it sort of like also becomes a little habit. They resist, they know they should be going and then they don't, and then they start moving their extremities. But important, yes, kids have that too, and they should get checked out. Okay, like I said, if they have other symptoms and issues as well. Jenna, thank you very much, ma'am. That was really, really good. Let's have, let's see if Miss what's her name? Miss Vijaya here? She's not here yet? Okay. Cool. I think if she's not here, then we can just bypass it. If no one has any other questions, we can just wrap it up here. And oh, Dr. Vijaya will be what? Okay.
So she's gonna be here like in a minute. She's just opening the link. So that's just taking a little bit time. Yeah.
Okay, that's fine then. We'll just hold on for her for a minute because I just want to do the next one with her and present with her. So very good, Jannah. That was good. We'll just do the treatment for the treatment they're gonna come in on the main so for the main topic and discussion. All right.
Yes, sir.
Very good. I have a quick question. Sophia, do you mind just sharing, meanwhile, your presentation, just the first minute of the presentation? Do you think you can do that for us?
Yes, sir. Sure. Just
Are you sort of
just
like
1 second.
So you're not going to play the full, but I just want to see how it looks the first minute or so. And then the first minute, I want you to sort of like present the first mock minute. Okay. So doctor, on that specific day, on that specific day, Dr. Sophia will be talking about obstructive sleep apnea. And we're going to be just doing a fixed first 1 minute sort of an intro. She's going to give like a first 1 minute intro. So let's start like, Sophia, you have the audience, you have the floor, and I'm going to say, hey, hi, everyone. Oh, by the way, the slides, let's go back to the mock thing. Oh, it looks really nice. I think Rida and the team, Malia and stuff, very good. It looks very nice. So I know you're going to be presenting. So you have the screen and share it with us. Let's see how it is. By the way, on that day, you should have your, we're going to have your presentations ready and we will have a look at them, review them. So go and. Does anyone know about sleep apnea? Before, by the way, in Zoom, you can use the chat button. It's after the audio video is the fourth button on the bottom. And you can if you don't want to talk and no one wants to say anything, you can use the chat button there and ask a question. If you feel like, oh, I don't want to, but the purpose, like I said, of the Zoom is to have you guys involved in it as well, right? So if you have any questions, somewhere along the line, your chakra is going to be broken. So if you have it right now, it's not going to stay for long. I'm going to have you forced to come in and do this. Talk about it. Okay? So
yes, sir.
Go on, Sophia, if you're ready. Just the first minute, not the whole.
So, so should I like give my intro as well in the start and then okay.
That's what I want to see, your intro.
Yes.
And I'm your co-host. So how do you want to do it? That's what we're going to do. I'm your co-host, Fatma. I don't know if Fatma is here. Is she here?
Yes, sir. She's here.
Hi, Fatma. Hi, Fatma ji. How are you? Is she in the talk? No, I don't see her. Because by now she would have said, hello, Dr. Khan. Okay. All right. I'll be your co-host. Go on, Dr. Sophia.
Good afternoon, everyone. My name is Dr. Sophia, and I'm working as a sleep virtual liaison in Pulmonx Plus. Today, I will be...
And good afternoon. I'm Dr. Khan, and I'm the managing director of Pulmonx Plus.
So today, I am going to be discussing a very critical health issue that's affecting millions of people worldwide, and which is related to our sleep, which is a very important part of our lives. So the topic of my presentation today is going to be obstructive sleep apnea. And today our focus is going to be on understanding what obstructive sleep apnea is and how it is related with the weight gain, obesity, and what's the impact of oxygen desaturation and heart rate fluctuation can have it. Because it is not just a common sleep disorder, but it's actually a public health concern because it is very widespread prevalence, and
Oh, I
its
would
health
love to listen.
implication.
I would love to listen about that then. That would be very, very nice. I know I don't even know if it's recognized in Pakistan, and a lot of them have heard about it, Dr. Sophia, but I would love to listen to it.
So let's just dive into the presentation, and I will be happy to take in any questions in between the presentation or at the end. Okay.
I don't think we can hear the voice.
I'm sharing my screen.
So basically, what Dr. Sophia is showing is what is sleep apnea and why it occurs. And as you know, that everyone sleeps supine, and then when you have a weight, the back of the throat, a lot of times the tongue starts making sound. And the sound and the vibrations of the pharynx, as being showed in the video, sort of triggers an event. And what are the events that lead to this? You're going to find out on Sunday about this. So play a little bit more, Sophia, this, so we can show and see how it looks. Very nice. And then it may be very underrated in, right, Sophia? You're talking about how many people are affected in America. A lot. It's not just that you are obese that you can have sleep apnea, but if you have a big mass or your throat is heavy, you can have an issue. But even if you don't have a soft tissue around your throat, if your back of the pharynx is tight and it obstructs the oxygen flow when you are sleeping, you can have sleep apnea. All right, so let's play a little bit more. We're going to go sort of like up to the 1 mark thing. Dr. Sophia, I'll let you talk a little bit about it. Just a little intro.
Now, this is the 2024 global studies about the apnea studies that actually shows that in Asia only, it's like 23% of the total population have sleep apnea.
That's
and 9%. That's a lot because
that's staggering. So would you say back in Pakistan, the people there are overweight? Let's say not obese, but are they overweight? Obesity is when it starts going above 30 plus 35, but are people overweight?
Yes, sir, for sure.
Do you think how much of people, if Australia, Asia is this much, do you think 1/4 of our population is also overweight and obese?
Yes, sir, I do think so, because if you see in America, that's 13% like at the start of 2024, but I can surely say that there is a rise, because we can see that around us, we have discussed this as well, that with the increase in fast food and stuff, the excess body weight that's increasing as well. And not only people are getting above BMI of 30, 35, so they are getting more prone toward the sleep apnea, because the more you gain weight, the more you are prone towards sleep apnea.
Very nice. Love it. Good. Okay, let's just play a little bit more. Okay, explain what you're showing us.
So there are three, we can say, stages or levels of classifying the sleep apnea. We have to classify the apnea according to the AHI level that we are seeing during the diagnostic studies that we do for screening and for the diagnosis of the sleep apnea. So if a patient is having less than 5 events per hour in their sleep, we say that they do not have any sleep disorder breathing or sleep apnea. But if they're having 5 to 15 episodes per hour, that's like if you stop breathing for 5 to 15 times in an hour, you are said to have mild obstructive sleep apnea. And if the episodes, they increase to 15 to 30, Then you have the moderate OSA. And if there are more than 30 episodes per hour, which is a lot, because like in an hour, if you have like 60 minutes and you are stopping to breathe like for more than 30 minutes, it's like severe OSA.
Gotcha. I think that's brilliant. I think Dr. Vijaya is on, Dr. Sophia, and just for the sake of time, I think you got a nice, brilliant presentation and script. We're gonna love to see this more on Sunday, where all of you are gonna can register your friends. Guys, this is not a medical just awareness about sleep. It's gonna be overall awareness about sleep in general. So bring everyone in your family. It doesn't matter what age it is, even if it's your kids, your friends, please share that link and get yourself registered. That's the main other aim that you guys should be doing. I want to just take a few minutes, Sophia, if you're okay, and let Dr. Vijaya and Akif present their case for quick 5 minutes, and then we call it quits because it's already touching 1 hour. Okay.
Assalamu alaikum, everyone. Sorry for being late. Okay, Dr. Sophia, can you just screen share?
Yes, I'm sharing.
Okay.
And is Akif going to be with you on this? Akif, you're there. So I want you to remember both of you present with you and Akif present, even though Sophia is going to be screen sharing.
Yes, sir, I'm here.
Hi there, Akif bhai. How are you?
I'm good, sir.
Okay. Akif bhai, have you got any slides in this and ready for the sort of time that mock later on?
Yes, sir, I have made 5 slides.
Okay. Is yours separate or are they with Sophia?
Sir, they are separate. We have two presentations.
Let's for the main presentation, you and Akif sort of like talk, right? Insomnia, Vijaya and Akif both
Yes.
be there. And your
Sir,
MBBS qualifications. Okay, we'll do it next time.
We will merge it for the final presentation.
Thank you, sir. We need to merge it. Okay.
Okay. Okay, so everyone, this is Dr. Vijaya, and today we will be discussing about insomnia. So what is insomnia? Basically, insomnia is a common clinical condition characterized by difficulty initiating or maintaining sleep. Like we are having the frequent awakenings or difficulty returning to the sleep after awakenings, or you can say awakening in too early with an ability to return to sleep. So this is characterized by something like irritability or fatigue during wakefulness. So what are basically the types of insomnia? We deal with 3 types of insomnia. One is acute, second is chronic, and then transient. I would like to explain a bit about all of these 3 types. So first of all, it's acute insomnia. Acute insomnia is basically short term, and it's very brief, and it occurs because of the life circumstances. Like if someone is dealing with some difficult time or having some issues with the life, then they sometimes suffer with insomnia, and I guess everyone is aware of that. So it is basically for a short period of time, and it does not require any treatment or any invasive methods. And then second is chronic insomnia. What happens in chronic insomnia is that it occurs at least 3 times per week and lasts for at least 3 months. So there are a number of at home. So there are a number of treatments. For these are the professional treatments, medications, and then the most important is CBT. We will discuss in detail later on in our discussion. And then there is transient insomnia. Transient insomnia is basically short term, and it lasts for up to 3 nights. And transient insomnia is temporary, and sleep will return to the normal later on its own. And okay.
So I think I'm gonna have interject on. I want to ask: is anyone in the audience have had insomnia?
So I guess most of the people suffers from that. So I guess.
Well, no one's raised their hand.
Sir, I've had insomnia.
You had insomnia. Okay. So
it was mostly transient or acute.
There is only 1 or 2% have insomnia.
So I guess
So the
acute or
question,
transient is more common, and most of the people suffers from that and not from the chronic insomnia. So
okay. So I want to hear from someone about their insomnia. I know a few of them said, and they're allowed to speak. Can they just sort of like raise their hand and say, they tell us a little bit about their insomnia? Let me just see in the, who said, a lot of people say, no, they sleep very well. You said a lot of people have it. I only see Aisha had it, Maliha had it, Marcy had it, or mother has it. I know in elderly, now you could say a lot of elderly people have insomnia. It's a very common issue that we see in the clinical practice, that they have insomnia. But does anyone in the audience have it? And does anyone want to talk? Let me ask Akif or Vajia, if you say, or Sophia or Jannah, all of you are there. Let's ask you first five. When do you know I have insomnia?
So I used to have acute insomnia, especially during my professional exams because of the stress that I wasn't able to sleep.
So you had transient insomnia. You knew you had insomnia because you could not sleep on the time of the studies, and it was stress related. And as soon as the stress goes, the day after the exam, the insomnia disappears. Is that right?
Yes.
Okay, so that's another. But let's say someone has an ongoing insomnia. How do they know they have insomnia? Anyone else besides Sophia? I know a few of them had said, oh, my mom has insomnia, but how do you know she has insomnia? Dr. Vijaya?
sir, as we can see that there is a classification that it would occur for at least 3 times a week for 3 months. So we can, get an idea that the person is suffering from insomnia according to this classification. So I guess that's the thing that.
And that's exactly the question Akif should ask you during the presentation. All right, we'll go over this, but it's like asking the question and then you trying to answer it. And Akif need to find a script where you as pairs ask the question, sort of like ask the audience or ask yourself the question, each other, and then you discuss, how do I know? Because if I don't pose a question, I'm not going to think about it. If you keep on telling me what is it, they're not going to question themselves. So the aim is they question themselves when is insomnia. You have insomnia basically when your normal routine sleep is disrupted. And then you also have insomnia if you have insufficient sleep. The duration matters. It also matters how long you've been having symptoms. That's part of the classification. But if you have difficulty falling asleep at a specific time, which is your normal time, or you wake up after a little bit of a sleep, or you wake up too early from your sleeping time, you could have insomnia. And then, so what if I have insomnia? Because a lot of times I hear these teenagers, I'm a Superman, doc. I just need 4 hours. I'm good. It's all my life. All my life I've been sleeping 4 hours. I said it's not possible. No, doc, you don't know me. I tell you, ask my mother. I was born and I used to not sleep 4 hours. And then that's where there is a problem, because they do not think they have an issue, and they wake up even in the morning. And then I just want to say this to you guys, and I've been putting the statistics out. If you sleep less than 6 hours a night, every 1 hour you sleep less, you lose 10 years of your life. So just think, you're sleeping 4 hours, how much life you're gonna lose. Not to tell you, you have a 40% chance of having a cardiovascular event. 40% chance more. Every time you're having, the red line is generally 6 hours. So if you're going below that, the chance of you having a heart attack or dying from an MI is very, very high. Other thing, the chances of you, when you hit 60, of having Alzheimer's and not having enjoying your later part of the life is also 37%. Very high. So you remember Reagan used to say, and Thatcher used to say, oh, we're sleeping is not good back in the 80s. Both of them said, oh, we only sleep 5 hours, 4 hours, 5 hours. They used to joke because we have responses. Both of them have Alzheimer's. Both of them didn't get above a specific age without having memory problems and stuff. So don't under easy. It's a big deal if you have any of restless leg, if you have any of insomnia, and if you have any of what Dr. Vijaya presented, sleep apnea. We're going to discuss this more on a little bit more presentation next week. And then Sunday, we'll have hope to see you all. I'm not going to ask any more questions today. Hopefully, we'll get more of your questions. I know you want to ask, but we'll answer them next time. But for today, I just want to thank you all for coming and joining. Do give us your feedback. So please put your feedback on this. And I would like, the team that just presented and my social media team just stay here, and all of the others can just say, have a good evening. Thank you very much. And lastly, before I go, please do acknowledge my team. They do a great job, on getting everything ready. Every week they're working very hard, and I don't want to forget them. And especially, the team here, Rida, Jeremy, Hamza, Malia, Umar, and everyone else, okay? With Zalika as well, doing a great job. Okay. Thank you very much, everyone. Stay blessed, have a good one. And then just gonna keep my other team members